for all women, get a smear test. Don't push it to one side like I did. I'd totally forgot about it. I mean, I think they said my last smear test was 2010. And I really didn't think it was that long. So if I had get my smear test earlier, they would have detected it earlier.
I think my difficulty was sort of getting into the system. That felt a bit where the barriers were really in those initial appointments. I would definitely say once you're in that system, that the support is really, really, really good. And, you know, from my point of view, you see how people are really overworked, but still do an amazing job to support you. So from my point of view, I think the NHS is still amazing.
I think overall it's been pretty positive. I've just had a bit of a can-do attitude. I am really thankful, like massively. I know I've said a few negative things, but I am massively thankful, and I am appreciative of what I've got. And to know that the treatment that I'm getting now, I wouldn't have got a year ago, is quite comforting. Another thing, actually, I didn't expect the menopause to hit me so quickly. I genuinely didn't know it was going to be a week after my operation. I was going through the menopause and not knowing that I was going through the menopause. A heads up on that would have been nice. I didn't realise it was going to be that quick. I thought it would be like a gradual. Well, yeah, why would I know that it was going to be a week after my operation? So it wasn't until I called my cancer nurse specialist and she was like, oh yeah, that sounds like the menopause. I was like, oh.
Quite often it's that build up to the point of treatment and you know, seeing people but not necessarily getting a test that will get the diagnosis over a period of weeks, to then find that they've got a cancer that has spread all inside their tummy and their pelvis must be really frustrating for people. I think that's where the biggest amount of work needs to be done, but I'm hopeful that with the new advanced ovarian cancer pathway, which is looking specifically at that point of referral from their local hospital to initiating treatment and throughout the treatment phase, I'm hoping that we can really make those make the time and the time to treatment and also the phase during the treatment much better.
What's quite interesting is probably communication with other health professionals in other specialities. So sometimes you'll get patients who are under you, but underneath another speciality, and nobody communicates. I think, again, primary care, we need more education within primary care. Just with, you know, recognising things like if somebody presents and they're doing a 2-week rule, for example, and they're looking at them thinking, they're a bit thin, emaciated, what's the weight? Let's start them on something that we can, you know, prehabilitation. You know, if they're not smoking, they're not exercising, there's a good opportunity to start them before they actually even get to us. I get very passionate about learning disabilities and mental health. We have not the easy read information. And I know with the advanced ovarian pathway, the first let we've done, I've actually sent away to get made into easy read. I think in all, we'll have a very good team in gynae oncology. It's a very open culture where we can all talk, say our thoughts, say our feelings, look at the research, what's best for our patients.
I think it's probably things that we're trying to tackle in terms of that time from hitting us to surgery. Because even pre-pandemic, they were often waiting 3-4 weeks, which is a long time when they're not very well, and they can go downhill quite rapidly. So it would be faster to treatment, and also as well when they're referred on for chemotherapy, faster to appointments and faster to treatment. That's going to be a difficult thing for us to tackle because it's a different trust. But I'm hoping that through this project we might be able to influence them in terms of we've speeded things up at this end, what can we look at your end that we can all as a team work towards trying to achieve. But it's got to be faster to treatment.